I'm sat back in the leather chair. It could be a huge mistake because it's rather noisy today. I think it needs to be sat in more often because then the leather will relax and not be so taut maybe, I don't know. It's very noisy today. I'll try to limit the movement. You will see that I brought Olivia in because it was getting quite windy out there, quite wild, and it's really getting quite cold. And I know that plants can survive outside. I know that she's a tree, but there's something quite nice about having her indoors. You might not think so. Last week, I talked about what sort of things you could do when the ward gets busy. That topic was purposefully strategic because, like I said, I know some of you are going out to placements perhaps for the first time. You could be first years or even second years going out to placement for the first time, and it's really daunting. It's daunting going out to practice at the best of times, let alone during a pandemic and going into winter. A majority of the time, things will be normal, they will be fine, you'll be working alongside your PAs and PSs, your practice assessors and practice supervisors, but there will be those times where it just gets crazy busy and the nursing staff will just do what they need to do in order to provide that patient-centred care that is effective and safe. The more experienced you become in your roles and the more knowledgeable that you become, you will be part of that core package of care delivery. You already are. The points I was trying to make last week were specifically around how you can protect yourself from feeling like you are not doing a good job, that you might not be necessarily wanted on the ward. And I know this because I have been there. We've all been there as students when we've qualified. It never leaves us. We do remember what it's like to be in your shoes. Some people do need reminding of that, but a majority of the time we all remember. I'm sitting here to hopefully support some of you that could be in those positions. However, this week, as I discussed last week, we're going to talk about what you do when the ward is calmer. Again, I have 5 suggestions, but this isn't the kind of end of the list. I could sit here for hours, but I don't want to edit a video that's hours long, and you really do not have the time to be sat listening to it. So the first thing I would like to say is if you are lucky enough to find that you're working on a calmer shift where things seem to be going to plan, the first thing I would say to anybody, because I have lived experience of it, is don't become too complacent. Don't take your foot off that pedal. When the ward gets calmer, we have a tendency to forget things. I have certainly found that when I am working on a calmer shift, if you have a patient that only requires once daily observations and maybe some oral medications before they go to sleep, because those patients do exist, they are still needing to be in hospital because we're monitoring their situation. I hope I'm not alone here, but I tend to miss that one observation of the day. And I really think this is because our brains are not engaged. They're not running at the usual pace, and we're not constantly thinking, right, what's next? So my advice to you is to not take your foot off the pedal, don't become complacent, and always keep an eye on the time and your tasks that are due. Moving on to some things that now actually you can do during times when it is calmer, is to go and sit at the bedside and talk to your patients. Talk to their families. If you're like me and you're a children's nurse, understanding the journey that that patient has been through and also their family members, it's really key to being able to deliver true holistic care. As a student, this activity is huge. One can never underestimate the impact that a simple outpatient's appointment can make when it all goes wrong. Or even if the outpatient's appointment is going well, there may be some feelings within those families of bereavement. It's so important to understand that some of the families that you might be looking after could be going through the bereavement process. And that's not necessarily grieving for somebody that's passed away, but it could be grieving for that person's health. Loss of control of their daily activities. There are many things that families go through that cannot be and must not be underestimated. So if you're finding that you have a little bit of time in the days and you really want to get to know a family a little bit more, then use that time to do exactly that. Make a cup of tea, make them a cup of tea, go in and enjoy that time with that family. Now, parentheses here, you kind of need to plan that in. So it could be that you meet in the morning and you're checking through your daily activity plan, and you might highlight that you've got a couple of hours free and you'd really like to hear about that family's journey. Book it in, plan it in, let them know that that's what you want to do. They will probably be open to that. Some families might not be, so it's always worth just checking. A little bit linked into this one is my next tip, and that's kind of around going through your assessment documents. So I work within London, so we have one assessment document that houses all the kind of London universities. It's great, it's easy to use, but like a lot of things, it is only good if the person using it knows how to use it. So that's obviously the practice assessors, practice supervisors kind of using your assessment document, but a lot of it comes down to you. If you don't know what you're being assessed against, then you're gonna struggle. And that is often one of the key things I tell any student that's finding themselves in a potentially tricky area. If you don't know what you're being assessed against, it's very difficult for you to demonstrate those values for the assessors and supervisors to look out for and appropriately assess you carrying out those elements of professional practice. So take some time to kind of go through exactly what's encompassed in your placement and look at things like what extra kind of activities have you got to do? Do you need to do reflections? Of course you do. Reflection is one of the cornerstones of the profession. Start learning it. There could also be some parts of the assessment document that you need to gain parent feedback, patient feedback. Have a look at exactly what it is that you need to complete before the end of that placement. My lights are flickering. Or is that my eyes? No, it's the lights. Can you see that? Or is that my eyes? No, it's the lights. I can see the lights flickering. Let's get this done before the lights go out. Another thing I would say is if you are finding that you do have a little bit more time, why don't you see if there's a sister ward, a satellite unit that attaches itself to your clinical environment to go and spend some time in those areas. Or spend some time with the other multidisciplinary team members that really link themselves to the core package of care that you're providing the patient population on your ward area. The final thing I'd like to say is a bit of an odd one, but hear me out. Being able to know and to demonstrate how research plays a part in the care that you're providing is paramount to being able to deliver evidence-based practice. As a student, evidence-based practice is going to be huge. We have to be able to deliver care that's based on the best available evidence that we have. So when you're working on a ward in any clinical environment, there will be research, nurses, if not a whole department, linked to the care that you're providing that patient. So as an example, as an oncology nurse, a lot of what we deliver, practically all of what we deliver, is based on research. So the care protocols that are written to be able to provide chemotherapy or any treatments for patients undergoing care for a hematological or oncological disease is based on research. The protocols are often a live research trial, and that's just one example. Research spans the whole of healthcare, and there will be something that intrigues you in the area that you're working in. So have conversations with the nurses that you're working with, or the clinical nurse specialists, or anybody that kind of comes onto the ward that you think they could be involved in some kind of research. Go and have a chat with them. If you're able to understand and articulate where the evidence comes from for the care that you're delivering to your patients, you're not only going to be able to understand it more, but you're also going to be able to deliver a higher level of care because you can appreciate the importance of how that care package was designed and created. Evidence-based practice, research in nursing, it's all huge. And no, this is not just because I'm doing my research module at the moment. This is just something that I always tell students whenever they have got a moment on the ward to look into what research goes on in that environment, because when you can actually see it happening, you appreciate it more. It can just sometimes help get your head around what research methodologies are in practice to then make your university assignments come to life a little bit more and perhaps even a little bit more enjoyable to carry out. So there we have it. 5 tips that I can give you of what you can do when the ward is potentially calmer and that you might have a little bit more time on your hands. And like I said, the first thing in this video, do not become complacent. Always try to fill the time that you've got doing something useful. Right, I'm gonna go because my eyes are sore. I'm worried that it's not the lights and it is my eyes. Always remember to reach out to people if you need support. There are so many people around you that can help. You're never gonna be alone, so don't isolate yourself. Until next time, look after yourself, guys, and enjoy your placements. Or quite complicated. That's what am I trying to say? What it's like for sort yourself out. Until next guy.